type 1 diabetes. Symptoms. Causes. Risk factors. Complications. Prevention. Type 1 diabetes. Hello friends, today we will talk about the type 1 diabetes. It is the part of a series of videos for diabetes awareness. Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin. Insulin is a hormone needed to allow sugar, glucose, to enter cells to produce energy. Different factors, including genetics and some viruses, may contribute to type 1 diabetes. Although type 1 diabetes usually appears during childhood or adolescence, it can develop in adults. Despite active research, type 1 diabetes has no cure. Treatment focuses on managing blood sugar levels with insulin, diet, and lifestyle to prevent complications. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one health care. Please also like, share and leave the comment below. Symptoms of type 1 diabetes. Type 1 diabetes signs and symptoms can appear relatively suddenly and may include increased thirst, frequent urination, bedwetting in children who previously didn't wet the bed during the night, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, blurred vision. Causes of type 1 diabetes. The exact cause of type 1 diabetes is unknown. Usually, the body's own immune system, which normally fights harmful bacteria and viruses, mistakenly destroys the insulin-producing islet, or islets of Langerhans, cells in the pancreas. Other possible causes include genetics, exposure to viruses and other environmental factors. The role of insulin. Once a significant number of islet cells are destroyed, you'll produce little or no insulin. Insulin is a hormone that comes from a gland situated behind and below the stomach, pancreas. The pancreas secretes insulin into the bloodstream. Insulin circulates, allowing sugar to enter your cells. Insulin lowers the amount of sugar in your bloodstream. As your blood sugar level drops, so does the secretion of insulin from your pancreas. The role of glucose. Glucose, a sugar, is a main source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, food and your liver. Sugar is absorbed into the bloodstream, where it enters cells with the help of insulin. Your liver stores glucose as glycogen. When your glucose levels are low, such as when you haven't eaten in a while, the liver breaks down the stored glycogen into glucose to keep your glucose levels within a normal range. Risk factors of type 1 diabetes. Some known risk factors for type 1 diabetes include family history. Anyone with a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Genetics. The presence of certain genes indicates an increased risk of developing type 1 diabetes. Geography. The incidence of type 1 diabetes tends to increase as you travel away from the equator. Age. Although type 1 diabetes can appear at any age, it appears at two noticeable peaks. The first peak occurs in children between 4 and 7 years old, and the second is in children between 10 and 14 years old. Complications of type 1 diabetes. Over time, type 1 diabetes complications can affect major organs in your body, including heart, blood vessels, nerves, eyes and kidneys. Maintaining a normal blood sugar level can dramatically reduce the risk of many complications. Eventually, diabetes complications may be disabling or even life-threatening. Nerve damage, neuropathy. Kidney damage, nephropathy. Eye damage. Foot damage. Skin and mouth conditions. Pregnancy complications. Prevention of type 1 diabetes. There's no known way to prevent type 1 diabetes. But researchers are working on preventing the disease or further destruction of the islet cells in people who are newly diagnosed. Ask your doctor if you might be eligible for one of these clinical trials, but carefully weigh the risks and benefits of any treatment available in a trial. If you didn't subscribe till now, please subscribe my channel and also press the bell icon so that you never miss the important video about your and your loved one healthcare. Please also like, share and leave a comment below.